अस्सलाम वालेकुम। आज मैं हूँ ज़हरा अज़हर आपके साथ, और आज हम डिस्कस करेंगे, जो आज का हमारा टॉपिक है, हम डिस्कस करेंगे कि हम लोग अपनी स्पेसेस को किस तरह से यूवी स्टेरिलाइजेशन टेक्निक के साथ हम उसे बेहतर बना सकते हैं। और ये टेक्निक हम अपनी स्पेसेस में, आर्किटेक्चरल स्पेसेस में, हॉस्पिटल्स में और डिफरेंट जगहों पे हम किस तरह से इस्तेमाल कर सकते हैं। और उसके बाद ये जो टेक्निक है, जो यूवी हमारे पास स्टेरिलाइजेशन टेक्निक है, और ये जो मैकेनिज्म है, और ये जो डिसइंफेक्शन टेक्नोलॉजी है, ये हमें किस तरह से आगे फ्यूचर में भी हेल्प आउट कर सकती है, और हमें करंट टाइम्स में भी, इन कोविड के टाइम्स में भी हमें बहुत ज़्यादा फ़ायदा दे सकती है। बहुत हमारी स्पेसेस को बेहतर करने के लिए, और उसको कोविड से फ्री करने के लिए, या कोविड को एंड अप करने के लिए किस तरह से हमें हेल्प आउट कर सकती है। तो इसके लिए अभी जो हमारे साथ आज गेस्ट हैं, वो हैं हमारे पास डॉक्टर जवेरिया हसन, और ये हैं हमारे पास आर्किटेक्चर डिपार्टमेंट की HOD भी हैं। तो अभी हम उनसे बात करते हैं इस बारे में, और फिर उसके बाद हम अपने एक और गेस्ट को इनवाइट करते हैं। जी, डॉक्टर जवेरिया। ओके, तो अभी हम अपने दूसरे गेस्ट को इनवाइट करते हैं, जो कि बेसिकली मैकेनिकल इंजीनियरिंग इंजीनियर हैं, और उन्होंने PhD की है न्यूक्लियर इंजीनियरिंग में। और इसके अलावा वो उनका जो ज़्यादातर उनकी बहुत ज़्यादा कमांड है, उनकी स्पेसेस को बेहतर करने के लिए, मैकेनिकली बेहतर करने के लिए उनकी कमांड बहुत ही ज़्यादा अच्छी है। और वो अभी प्रोफेशनली काम कर रहे हैं डिफरेंट कंट्रीज में, डिफरेंट कंट्रीज के प्रोजेक्ट्स को डील कर रहे हैं। तो वी वेलकम सर नॉर्मैंड ब्रेस। हेलो सर, हाउ आर यू?
Hello, I'm well. Here it's earlier. You're at different time zone. It's here it's 9 in the
Yes.
morning in Canada. So I thank you for your invitation. And I haven't talked to Javier in a long time.
Okay.
We met once in Kuala Lumpur about 7 years ago, I think. And she saw a presentation I did at the time on ultraviolet disinfection. So I will be pleased to share my knowledge with you on this subject today.
Okay, sir. Thank you. Okay, sir. So we are starting with the topic that can you give us some review about the UV disinfection technology and how it works in our spaces uh, with respect to the hospitals or the spaces dealing with the public health and the health of people?
Yes, since the beginning of the COVID pandemia, there's been a big concern about airborne aerosols when we breathe, when we sing or shout. We emit a lot of aerosols, and those aerosols are very small. They range from 1 to 10 microns, and they cannot be seen. But the virus is even smaller. The virus is zero point 0.1 micron, so 110 to 100 of the aerosol. If the air is not very humid, this droplet will evaporate quickly, and then the aerosol, the virus itself, will float in the air for many hours. And the ventilation system can be a system that will spread the virus around inside building. So there are many ways to counter this effect. We can, for instance, increase ventilation, which is not always possible due to restrained duct size and fans. We can add filtration. Filters do a good job. We can go up to MERV 13 filters, but even at that size, because of the small size of the aerosols, they will go through the filters. So UV is a second line of defense. Whatever goes through the filter, we can kill it with UV. The way UV works is pretty simple. It's been used for over 50 years for water disinfection. And the way it operates is it breaks up DNA and RNA of any living organism. So it doesn't matter whether it's tuberculosis or, in this case, SARS-CoV-2, the COVID virus. They're all made of RNA or DNA, and we can damage that DNA and RNA with ultraviolet dosage. And the values are well known, it can be calculated, it's a real science. And this way we complement what the filters are doing. Whatever goes through the filter, basically, we size the UV system so it can intercept and destroy whatever viruses penetrates the filter and gets out in the air. And in this way, we can have up to 99.9% elimination in the air of the, say, the SARS-CoV-2 virus in an environment, and make sure that if even you have like 10 people in a small room, if the air in this room is purified fast enough, there will be very little transmission, indirect transmission. I mean, of course, if we touch each other and we touch our nose and touch our eyes, then there will still be some contamination. It means you still have to be careful about touching touch zone and direct transmission. But at least the air is not as much a vector of transmission if you can purify it to a certain level.
Okay, sir. Okay, sir, you also have the command on combustion pollution and water treatment, because the COVID is also transferring from the carriers through the carriers. So, what about these carriers? Like we have the pollution in our environment and the water treatment, especially. How can it make the situation better? Because water pollution is also a fact of our society and the era. So, what about this point?
Yes. Well, in you have two types of water. The water that we use for drinking, that in the water that we put in bottles are most of all sterilized with ultraviolet since the 1990s. So for over 30 years, we have had that benefits of using ultraviolet for sterilization of water. Then there's the sewage, like used water. We can also reduce the E. coli, the coliforms in used water before sending that water into a river, for instance. So ultraviolet can be used also to reduce the infection level of the rejected water.
Okay, okay, sir. Sir, what about the hospitals? What about the hospitals? If we look at the hospitals, yes, ma'am, you want to say something?
Question. Norman, hi, how are you? Very long time.
Yes.
We are married again, and it's a lovely time, but unfortunate time of COVID. So I have had two questions from you. Number one, at the micro level about UV light, because it is not not it has negative effects on the human health. So therefore, I wanted to say that how do you prevent that? Do you have a robot attached to the UV so that the UV could easily undo the
Yes.
scenario? Or number two, my baby wants to say hello to you. Hello, Bryce.
Hello. Hello. What's his name?
Merban.
Merban. Hello,
Yeah,
Merban.
very kind and gentle, it means. So, number two, about the mask at the micro level, how do you desanitize and make it reusable by undoing the COVID and SARC effect on the mask? So, kindly please give me an answer to that. And also for the COVID, how efficient is your UV to COVID? How much experimentation have you done, and how have you found the UV light to be effective towards COVID?
Okay.
100% or 99 or 85?
Okay, I will start with the mask because that's what got me into the COVID crisis back in March last year. Everywhere in the world, the mask N95 were becoming a shortage. Everybody was looking for them. So I started working with a French partner in France, and we started testing ultraviolet on N95 mask. And that's when we were able to do some experiments and be successful actually to find out that the UV could penetrate deep inside the mask and get all the way through and measure basically the UV that was going through the layers. Yeah. We tested mask N95 mask with 5 layers. the FFP2 that they use in Europe, and we were able to find that it really penetrates inside, and also we were able to find what dosage it takes to destroy COVID-19 virus. And the good news is the virus doesn't take much of a dose. It's a very weak virus when it comes to ultraviolet. So we don't need to have a huge system and big power to eradicate it with UV. So that's the good point. And the data that we have comes from the French Army lab. We got the data in April, last April, about the sensitivity of the COVID virus to ultraviolet. And then we were able to apply it to all the other designs. And as you said, Javiera, it's very UV will destroy any types of DNA or RNA. So you will not want anybody to be exposed to UV light, because that's what we're made of. Our skin is made of proteins and DNA also. So we have to have safety systems, I mean motion detectors, and that the UV light is immediately shut if someone walks into a room. So for surface disinfection and room disinfection, a UV system must have a very reliable safety system to avoid anybody from exposure, direct exposure. The other systems that we have, we put them into the ventilation ducts, where of course nobody goes. So in those, the only thing we need is a safety switch on the doors for the access to the ventilation ducts. So if someone opened the doors, well, the light shuts off. So that's how we do it. Yeah. Did I answer all your questions?
And how do you see the difference between the host as a house becoming a hospital? Because now every home has become a hospital and a place for quarantine. And this is what we used to discuss when we were earlier in our career, that how important hospital is. Now we have realized that it's actually extremely important, because now universality has been applicable to each and every house, and even every local house has become like a place where it has become a mini hospital, and it has to be the corona, so that with the UV, because, and what about the surfaces? How is it being applied over the surfaces, and how it is maximum efficient and maximum applicable to the surfaces where corona is usually being carried, or where it is maximum transmittable, or it can stay on the surfaces. So how do you deal with the surfaces with the UV light?
Okay, well, that's a very good question. It depends on the like you said, the area of the room, but also the number of occupants. If you have a room of say 10 square meters or 20 square meters, but you have 10 people in the room, it will be very difficult to prevent transmission. So there are two factors: the size of the room, the volume, but also the number of people, number of occupants, and uh, and also the level of activity. If you're inside of a gym and you're running, there, there's a lot of noise. I,
Uh,
I don't I don't know. Some people
okay,
have.
so now it's clear.
Okay,
Now,
okay,
now
now
it's
it's good.
fine.
No, it's fine. Okay,
Okay,
good. So,
okay.
yes, I was saying that the important thing is the size of the room, the volume. Then we can use portable air purifiers. And the idea of for the volume, you need to have at least 3 air changes per hour to do a decent job with HEPA filtration and ultraviolet, a combination of the two, in 3 air changes per hour. If you size it that way, you get a very good reduction of potential level of, because we don't catch COVID-19 with only one dose. There's a quantum of how many viruses you come into contact to be infected. So it's not one virus, it's not probably 10, it's probably more like 100 to 1,000. So if you can reduce, say if the level originally is about a million particles per square cubic meter, then if you can reduce it by 99.9% quickly, then the transmission is broken. Transmission chain is broken. But that depends a lot on the number of people that you have into the room and what kind of activity. Are they talking loud? Are they singing? For instance, there was a case of what we call a major spreader in United States where people went to sing into a choir. So you have 60 people singing, and when you sing, you spread a lot of particles.
Obviously.
Yeah, so this way, 60 people, although the room was big, but they're all together and they were all singing at the same time. So the contamination was huge. They contaminated each other a lot. But if you're at a certain distance, you talk, and if you wear a mask, even a surgical mask, you prevent the output. You reduce the output of aerosol, like Javier is doing now. And this way, you get a reduced level of aerosol in the air, and you ease the job for a portable UV purifier. So typically, we did some studies here for schools. Like if you put 30 kids in a classroom, we calculated you need at least two and preferably three air purifiers, portable, with 100 CFM each, to get to the level of 3 air changes per hour, 3 air purification per hour, to try to knock down by 99.9% the aerosol in the air.
Okay, sir. One more question. As we know that the corona or COVID is changing its forms continuously, and so what are the challenges we are facing? Yeah, will have to face in future during the use of UV disinfection technology. So how can it prevent the changing forms of the COVID?
Well, the nature of, as you said, the nature of the virus, COVID, like any other virus, is to mutate. They will mutate in contact with humans. They've already started, and it's just normal. It's just like the flu. The flu that we got 100 years ago has mutated, and we know there are 144 varieties of flu. So every year, the challenge is more for the people who make the vaccine. Every year, they have to decide what vaccine will be effective against what variant of the virus. It's the same thing with, I think it will be the same thing with the coronavirus. Every year from now on, we'll have some variations of the same virus, because now it's in the population and it will mutate. And we'll see probably hundreds of variants in the future years. As far as UV, the variation doesn't matter, because basically we're attacking its RNA. So even if the RNA is a bit different, the UV susceptibility will not change much. It's just a rearrangement of the uracil and guanine pairs, but the rearrangement will not change much for UV dosage. We noticed that with flu. We have the dosage for flu against the UV against flu, and it hasn't changed much over the years with different variants. But it will be a challenge for the vaccine makers over the next few years to identify if the vaccine is effective against the variant.
Okay, sir. Okay, so sir, I have one more question. What are the fundamental principles that we can use for the UV sterilization mechanism? What are the principles we can follow to use this technology and this technique?
Well, you need to look at the volume of surface, the number of people, and you can follow. There are some ASHRAE guidelines actually on this subject that are coming up. We have already a chapter in 2008 ASHRAE about UV and how to apply it. One of the biggest reservoir of molds, bacteria, and viruses are the cooling coils. The air conditioning cooling coils are a fantastic condominium for bacteria and molds. They a big reservoir, and one very effective way to eradicate those is using UV. It doesn't take much power because the time of exposures is very long. You can expose that coil like 12 hours a day. Nothing will grow on it. So this removes a big source of biocontaminants inside a room. And it's a very cheap way to do because you don't need much power. The electrical consumption and the number of lamps, UV lamps, is very small to keep a coil clean. So that's the
Okay.
first step. Yes.
Yeah. Okay, sir, you were talking about the coil disinfection technique and the coil system we can use in our walls, in our floors, or maybe in the ceiling. So, sir, can you elaborate something about that, how it works uh, with this scenario?
Well, if you have if you want to do air disinfection, you can use, if you have a mechanical air system, you can put it in the ductwork. Anywhere in a straight length of duct, you can install some UV lights, and we have some software to calculate the dosage that is delivered. So we know at each pass how much percentage of any kind of biocontaminant, how much percentage is removed or destroyed with the UV light. Uh, and then you can always upgrade the filtration. Typically, what we found is going from typical MERV 8 filter to MERV 13 is a good choice. The pressure drop does not increase that much, and you get a much bigger capture of particle. Above that, I don't recommend going to full HEPA filter because that's too much pressure drop. The systems cannot handle it, and the cost is most of the time prohibitive. But MERV 13 is a good point where you get the performance without too much additional cost and without too much pressure drop, so you maintain your airflows.
Okay, sir. Okay, sir, we have one more question that this technique, the UV technique, it can be applied to all the types of infections or allergies or something, or it can specifically treat the COVID thing, the COVID infection, or like it's suitable for both kind of things or for the COVID.
No, it's actually a very wide spectrum. It makes no
Okay.
difference. It will basically damage DNA and RNA of any microorganism that it sees. So it's a very wide spectrum to make a building immune to all kinds of microorganisms.
Okay, sir. Okay, sir. I have a question that what about the filters we are uh, using in the mechanical system? So, what are the filters that we can use, and how can you suggest about some specific filters that we can use for this purpose in the mechanical system? The filters in the mechanical system.
Yeah, like I said, what I recommend is to upgrade to MERV 13 filters, which is a very good compromise between pressure drop and particulate size removal. It removes a lot of aerosol. It will be like about 75% effective against 3 to 10 micron. So it will do a good job without costing too much.
Hmm.
Um, I know a lot of people are pushing for HEPA, but that's most of the time not possible.
Okay, sir. Okay. Yes, ma'am. Can you add something in it, ma'am, Dr. Javeria?
Yes, I wanted to add that it yeah, I wanted to say that number one, it is a very difficult time globally. So, how your government can in Montreal, what is the strategy and the policy change in this year of 2020, last year, which we saw, and the upcoming post COVID scenario? What are the specific policy changes that you think have been added in Canada specifically? Because as a country, it is doing very well to fight this very difficult time.
Yeah, well, the situation is difficult. We have lots of advice from scientists, but like everywhere else, the politicians have different ideas, and most of the time, if you say, well, we need to upgrade ventilation, we need to ventilate more, if the government says, well, we don't have money, they'll find a good reason for not doing it. Uh, that's typical everywhere now in the world.
Yeah.
Basically, the scientists, we know what needs to be done, but the budgets are not there. And as a result, they just say, well, stay away from each other, wear a mask, uh, and don't get into groups, don't get together. And here in Montreal, in Canada, we have a curfew. We cannot go out after 8 at night till 5 in the morning over the last month. So that's the best that the governments have found yet. Uh, and of course, there's a huge impact on the economy. All the restaurants are closed, all the hotels. Uh, Everybody works from home, like I do right now. I'm at home, and I cannot go to work. Lots of places are in that situation. So really, everybody is hoping for the vaccine to come to sort of save us. But I think in the future, we will have to learn to live with that virus uh, all the time. There will be improvement in ventilation, improvement in behaviors of all kind, so we can limit the spread of the virus. Uh, I don't think that just a vaccine will do everything immediately, because they will be probably variants that will be not as vaccine will not be as effective against. So I think we will have to learn to live with this virus for a long time and change our ways of doing things.
Yeah. Okay, sir. Okay, sir. We were talking about that. We also have the COVID layer in the first layer of the COVID. It was kind of panicking situation and all, and now we are living with it in the second layer. So, what you can refer to that we must have a better human behavior in this reference, or uh, we should have a better technology to rely on, to depend on. So what you can say about it, what you suggest about it?
Yeah. Well, changing human behaviors is a very difficult task, uh,
Obviously.
almost impossible. So,
Yeah.
so definitely we will have to have better technology to try to eliminate a lot of the transmission. And we were not really prepared for that. And I think a big part will be better technology and applied properly to reduce the risk of transmission, because you cannot confine people and close everything, every place. For instance, there are possibilities in restaurant to put a better ventilation system, to have like little hoods on top of each table that would suck the air up and purify that air and recycle it. That would be possible. And if you look at it reminds me of the Korean barbecue restaurants where you have a little hood that takes the smoke up. Well, we can have the same thing, but for air treatment, and then we can reopen the restaurants. So I think there'll be lots of innovation in the future with that will take care of indoor air quality and make sure we don't transmit the virus that is airborne. Then for the touching, it's a matter of personal hygiene. And that also is a difficult behavior to change, but not so much. Um, but the behavior I think that we cannot avoid is we like to get together and eat together and talk together. That we will have to need the help of technology so we can get back to this activity.
Yeah, okay. Okay, sir, as we have the integrated systems, we have the integrated architecture where we are working like a mechanical engineer, an architect, an electrical engineer, or a plumbing engineer, the MEP systems and all. What you can suggest to the architects that how they can plan their spaces in a better way, as you have been worked with architects also. So, what you can suggest about the planning of spaces and in this reference, what you say?
Well, the planning for architects is to make living spaces
Yeah.
better for actually probably in some places limit the number of people in a given place. That's one thing. You see that for uh, lifts, elevators, maximum number of people. We can do that in several rooms to not to have a crowd that is over the capacity of the ventilation system. That or upgrade the ventilation system or both. I think that will be part of the responsibilities of architects to make the ventilation and the number of people allowed in a room a certain limit to reduce the risk of airborne transmission.
Okay, sir. Actually, but we also have the challenges like in the public spaces, in the halls. So this is a challenge basically for the architects also to
Yeah.
design the spaces in the current scenario, because it was uh, unintentional or unexpected scenario. So, sir, how you can summarize our whole discussion about the UV technique of the UV sterilization technique, and how can we do better in our future?
Yes. Well, to summarize it in very quickly, I think filters. We are used to filters. We use filters a lot, even mask and things like that, and we know how they work. Filters capture, but they don't kill. Uh, the
Yeah.
UV does not capture, but it kills. So basically, UV makes no prisoner. That's the idea. Uh,
Okay. Yeah. This is a good word. A prisoner. Okay. Thank you so much, sir, for your time, and because you have shared a lot of information with us and with our audience. So thank you so much, sir, for today's session, and we have a great time with you. Thank you, Dr. Javeria. Thank you.
thank
Namaste.
you.
Thank
Bye
you.
bye.
Thank you so much.
Bye to
Oh,
all.
bye. Bye, sir.
Bye bye. Take care.
Okay, sir. You too. Thank you.